Okay, so let's get started on the presentation. As Chris said, this is a series of webinars that the Centre for Economic and Social Rights is co-organising with the constituency. And each of the three webinars aims to build on each other so that by the end of the three, participants have a good kind of basic introduction to how to look at and assess policies, including urban policies, through the lens of human rights, and in particular, economic, social, and cultural rights. So on Tuesday, we started off with quite a high-level look at what economic, social, and cultural rights are, and importantly, what obligations they entail for governments and other powerful actors. And when we kind of left the conversation on Tuesday saying, well, these are helpful concepts and they're helpful criteria to be able to look at particular policies and particular contexts to see whether or not governments are meeting their human rights obligations. Actually making those legal standards and those legal principles more tangible and more concrete is important in order to really be able to use them in research and to use them in our analysis. And so what I'm going to focus on today is a framework that we use in our own work at the Centre for Economic and Social Rights, but also in a lot of collaborative work that we do with others that takes those norms and transforms them into kind of a more structured way of doing policy analysis. So I see a few familiar names and faces from Tuesday, but also that not everyone was with us then. That's not an issue. If you want to go back and have a look at the slides and the recording from Tuesday, you can scroll back through the Google Doc that Chris shared, and the links to both of those are included for Tuesday's session. But I'm going to begin the presentation today with just a very quick recap of some of the issues we covered so that you have the context for the framework that we're going to share. So the framework that we're going to talk about today uses the acronym OPERA, and it's called OPERA because it stands for Outcomes, Policy Efforts, Resources and Assessment. And you'll hear me say that over and over again as I present, so don't worry if it hasn't sunk in the first time. OPERA isn't a new framework. It's something that we developed in 2012. And as I said, it's both a guiding lens for our work and also the basis for support that we've provided to partners over the years. And as it's been used and reinterpreted and adapted and applied, you know, that's really refined and enriched the framework. And so we love sharing it because every time we do, we get different questions and different perspectives on how it might be applicable to the work that different groups are focused on. And so it's always timely to kind of go back to basics and give an overview of what it covers. So I'm going to touch on three things in the presentation today. The first is kind of why did we develop this framework? What was the challenge that we were trying to address with it? How does it work and what are some of its key features? And then what does it look like in practice? And I'm going to run through a case study of where we used OPERA to do a piece of research to kind of show concretely what it looks like. Kind of starting off, why did we develop OPERA? When we were talking on Tuesday, as I said, we kind of left the conversation feeling like, well, a lot of violations of economic and social rights are quite complex and they're very multidimensional. And sometimes as activists and as activist researchers, it can feel a bit overwhelming to kind of unpack all of those different dimensions of a particular situation and understand some of the root causes that are creating it. Concretely, what does that look like? Well, the case study I'm going to talk about today is work we did on maternal health in Guatemala. So just to say a few words about the context that research took place in. This was in 2011 that we published this report, and in the context of looking at a country that, despite being a middle income country and being the largest economy in Central America, was really lagging behind its neighbors in terms of its development levels. And kind of that was accompanied by very stark examples of inequality. So you had, on the one hand, half the population living in poverty, and on the other, the highest number of private planes and helicopters per head. In part, there was a legacy of conflict and racial subjugation that could explain that. But there was also a sense that fiscal policy, in particular tax issues, were really creating some of the blockages that were preventing the country from advancing further in its development commitments. And it's notable that the partner that we did this research with was actually a fiscal policy think tank. So they had a sense that there was kind of political blockage around the issue of tax, and that this was having a real development impact and a human rights impact in terms of really harming people's lives and livelihoods. But they wanted to bring in a human rights analysis in order to really make those connections more strongly. And likewise for us, an organization that works on human rights, we had a sense that there was some issue around financing and resourcing and investment that we needed to dig into, but wanted to bring in that perspective and that expertise into the research. The research actually covered 3 issues, but I'm going to focus today on maternal health. And one of the reasons why maternal health was chosen was because at the time it was the Millennium Development Goals. There was a key development commitment about reducing maternal mortality. But it was also an issue that had been declared a national priority by a number of successive governments. So as I touched on Tuesday, one of the things that makes issues like this, like poverty and inequality and maternal health, hard to kind of dig into from a human rights perspective, is because these 4 components of A, B, C, and D are quite far apart from each other. So we have a rights holder here, the women in Guatemala, but that's a very big and a very kind of hard to count population group. What their right is to be able to give birth in a safe and healthy way, but without I'm losing my words here, without avoidable risks. Against who? Who has to do what to ensure that right is guaranteed? That's where things really start to get less clear. Who's the duty bearer, and what is it exactly that they have to do to ensure that women are able to go through pregnancy and childbirth safely? And because of, as I said, I was talking on Tuesday, it's a situation that's not black and white. It's a situation that's quite gray for the reasons I've just said. And that means that we're looking at the reasonableness or not of the conduct of the government and other responsible actors, and the criteria, whether or not we can determine whether something is reasonable depends on whether it meets these human rights obligations. And here's a summary again of the obligations that we went into in a bit more depth on Tuesday. And as you can see, there's a number of them. There's at least 7 or 8 there. And they fit together in quite a complex way. So in developing OPRA, we wanted to provide a more simple and a more coherent structure in order to build a persuasive advocacy argument about whether or not those obligations were being met. And particular to kind of fill that gap between linking evidence about a state's conduct, in other words, what it is or isn't doing, with evidence about the outcomes or the results that is having for people, what that means in real terms in people's lives. And so it's a tool that can be used throughout the research process, and I'm going to come back to that a little bit more, but its kind of key feature really is its flexibility. So this slide here just gives its kind of very basic framing. And in a sense, it's really a different way of understanding what a human rights violation looks like. So we start off from the perspective of the rights holder and we ask, what's the problem? Then we shift gears and look at the perspective of the government, and we ask, how have their actions affected the problem, either positively or negatively? How has the use of resources affected the problem? And resources is a really key dimension that I mentioned in the Guatemala context, but often in most contexts, is what's determining whether or not policies are being well implemented. And then the final question is, in light of the broader context, what can we say about government's responsibility? And for each step, it sets out some sub areas or sub dimensions that we want to look at. And there's 3 for each of them. And what's the kind of key feature here is that all of those obligations that I presented a few slides ago in the Venn diagram are now organized around these 4 dimensions and the 3 kind of areas that fit within each. So, for example, non-discrimination and progressive realization are outcomes that we might want to assess. And this link between kind of measurement and norms and standards is really one of the critical features of OPRA. So that very multi-dimensional and complex set of obligations, it's now organized, we hope, into more manageable and more bite-sized chunks that researchers can look into. And a final feature is that OPRA doesn't just set out kind of questions to answer, it also suggests tools and methods that can help us as researchers in answering them. And on Monday, I think is our final session, we're going to go into more detail about what those are. So I'm going to move to the case study now and talk a bit more about what each of these steps concretely looks like by walking through the example of how we applied it to maternal health. So starting with outcomes from the perspective of the rights holder, where we often use in this step socioeconomic indicators. So indicators that give us a measure of well-being. Sorry, the dog's barking in the background. And we've found that indicators are quite a useful tool in this step because they give us a comparable and standardized measure. And then we can interrogate that data against relevant international standards. And the first one, as I said, starts with looking overall at levels of rights enjoyment. And so in this case study, the indicator that we were using was the maternal mortality rate. And we can see that when that data is compared to others in the region, that Guatemala has the highest in the region, almost at 300 deaths per 100,000 live births. So that's the kind of first starting point, is the overall picture. Then we can disaggregate the data and look at how different groups compare within the country. And the reason we want to do that is because disparities in the levels of rights enjoyment might suggest possible discrimination, and certainly will show inequality. And what the data showed in the Guatemala case was that Indigenous women were 3 times more likely to die in childbirth than non-Indigenous women. Sorry, childbirth or during pregnancy. And then the third dimension that we looked at was how have things changed over time? And that's a way of measuring this requirement that states should be progressively improving things. And so we look here at the data of comparing Guatemala and Bolivia, which were the 2 countries that had the highest maternal mortality rate. And we can see that while Bolivia has made a lot of progress in reducing its numbers, Guatemala's numbers have actually gotten worse. And actually, again, if you disaggregate the data, you can see that progress has been even worse for rural Indigenous women. So that gives us an overall picture of outcomes and highlights a number of particular red flags that suggest that women's rights are being violated in this context. As we talked about on Tuesday, we also need to look at the conduct of governments, not just the outcomes that those are leading to. And so that's what the next step does. It switches gears a bit and looks at the perspective of government. And our starting point is to look at the obligation to take steps. In other words, what action, if anything, has been taken. And this is less quantitative. We're often looking at legal commitments, at political commitments, at development commitments, including to some of the big development agendas that I know you're all working on in different ways. What we found in the case of Guatemala was that they did have a very strong framework for the protection of maternal health. They'd signed a number of conventions. There was a constitutional guarantee of the right to health. The peace accords included a pledge to reduce maternal mortality. So on paper, a lot was being done on this issue. But of course, what's put on paper and what is happening in practice don't always match. And so the next part of this dimension, of this policy efforts dimension, looks at implementation and asks, how has what's on paper actually translated in practice into the infrastructure and the goods and the services that people need on the ground to realize their rights. And you remember on Tuesday, we talked about the human rights criteria for judging whether or not goods and services are appropriate or not is the criteria of availability and accessibility and quality, etc. And in Guatemala, we found that there had been very little progress in a number of different areas, in particular in relation to the distribution of obstetricians and gynecologists across the country. For example, skilled birth attendance was very low. It was just over 40%. And emergency obstetric care was fell very far short of UN guidelines. And the map here shows the comparison between rates of maternal mortality in different parts of the country and the number of obstetricians and gynecologists that were working in those areas. So a very clear correlation between those two. As well as that kind of more quantitative data, we also interviewed rural Indigenous communities, and their testimony and their evidence provided complementary indications that the quality of services was also very poor, that there was a lack of essential surgical equipment and medical equipment, and that a lot of the services were culturally inappropriate for Indigenous women. And the final part we looked at in terms of policy, issues success of policy making. Again, this was an issue that came up on Tuesday, that one of the strengths of the human rights framework is it looks not just at what policies are being enacted, but the way they're being designed and implemented as well. And we need qualitative here to understand whether policy making is participatory and transparent and accountable. As I said at the beginning of the presentation, often the issue around the gap between commitments on paper and implementation in practice has to do with resources. Underfunding of programs is quite common. And the claim is often that from governments is like, well, we can't invest more because we don't have any more money. And so this dimension of opera, the R of opera, really tries to interrogate that claim. And it starts off by looking at budgets and looking at how much is actually allocated to the area that we're interested in, not just again, kind of on paper, but also in practice too, whether what's allocated is actually reaching groups. And so in the Guatemala case study, what we found was that allocations, Ministry of Public Health, were less than 1% of GDP for almost a decade, and that's for the data that's shown in the graph here. And by contrast, countries in the region that had good health outcomes were spending more, around 5% on average. The spending within the country was also very uneven too. It was 3 times higher in metropolitan regions than in rural areas. And it had actually decreased over time. So again, we're looking at those trends of overall comparisons, disaggregated by different groups, and then whether things have changed over time. As I mentioned again on Tuesday, kind of a really key piece of this obligation to dedicate resources to the realization of rights isn't just about how the pie is sliced, the division of resources, but also how governments are generating resources, how they're raising money, either through taxation or through government borrowing or through other sources. So we also looked at the revenue side of the budget, not just the expenditure side of the budget. And what we found in Guatemala was that low public spending was a result of a small government budget. It was at the time about 15% of GDP compared to a regional average of 27%, so almost half. And even though tax was the main source of revenue for the government, it made up, I think, 94% of its budget in 2008, it had a very low and a very uneven tax burden. So it meant it was what's called a regressive tax burden, in that lower income households ended up paying a higher percentage of their income in tax. And if you're interested in more about kind of a human rights analysis of fiscal policy, I can add a bunch of extra resources in the Google Doc for you to look at, because it's a really kind of critical area that's getting a lot more attention at the moment. And so what this graph on the right here shows is tax as a percentage of GDP, and Guatemala is fourth from the bottom there, so quite low. And the third part of resources that we look at, again, is around process. How is tax policy being designed and implemented? And whose voices and whose interests are being heard the loudest in fiscal policy decisions? And after having looked at those first three steps, the final dimension of OPRA we call assessment, but assessment does a few things. First, it does a bit of work to kind of contextualize what's come out of the first three steps so far, and then it ends with an overall assessment of whether or not governments are meeting their human rights obligations. So the first part of it is to look at the bigger contextual issues that are that the population is experiencing, or the group that we're doing our research with and for is experiencing. And with the technical kind of term that we've used here is other determinants. So those of you that work in the health space will recognize this term of kind of what other factors are at play here that might be influencing people's ability to realize their rights. And so, a lot will come out in some of the earlier steps of the process, but some might need further analysis. So, for example, on the issue of women's reproductive health and maternal health, family and community influence can be a real factor that can either help or can hinder women's access to reproductive services. That is kind of a bigger contextual issue that we might need to look at. Then we also want to look again at the broader contextual factors that are at play that are affecting the government's ability. Are they unwilling, or are they unable to be doing better on the issue that they're working at? And the goal here isn't to give them an excuse and to let them off the hook, but rather to help make the recommendations of the research more specific and more targeted and more contextual to the real challenges that are being experienced. So, for example, there might be third parties or non-state actors whose influence is affecting the state. We might be looking at issues of corruption or of business misconduct or of donor influence, especially international financial institutions. There might be kind of more structural issues like political instability or kind of broader trade and investment rules that are affecting governments' autonomy and discretion to make policy decisions. And what we looked at in the Guatemala case was elite capture. And there was a very powerful kind of economic force that was really lobbying very hard against the kinds of tax reforms that would be able to generate the resources to improve public spending and improve social spending. So the final piece is to put all of these different elements together and kind of thinking about opera like a diagnostic chart. We've started to see some red flags. We've started to see some links between them. And by combining that evidence and interpreting that evidence, we can highlight kind of powerful facts and iconic stories that show the interconnections and connect the dots between these different issues. And so the main point is to kind of end on is that each step of opera or each dimension of opera shouldn't be seen in isolation. But taken together, when we bring together these 4 dimensions, you have a very compelling case to be made that Guatemala's high and unequal levels of maternal mortality resulted from a lack of will to invest available resources, not a lack of resources in and of itself. And that Guatemala was a government that had ceded space to private markets and started to treat people more as consumers rather than citizens. And so health as a result had become a commodity for the wealthy, not a right for everyone. So I'll leave it there, but just to kind of recap on the key features of opera, it's about bringing together the standards and principles and grouping them into 4 dimensions, but those 4 dimensions aren't rigid. Sometimes you might spend more time on policy efforts or more time on resources or more time on outcomes. For each dimension, it gives you a checklist of questions that you can use to measure norms. But how you go about answering those questions is quite flexible, and the techniques and the tools can be changed and adapted depending on the context of a particular project. And its flexibility means that every time it's used and adapted, it evolves further and further. So very much looking forward to hearing some reactions to it and to answering questions about it. Thanks. So I think we've got 20 minutes left on the agenda. I thought we'd start just, any clarifications or anything you want me to say a little bit more about. Otherwise, we've also put a prompt question to throw back to everyone to hear from you a bit more about as well.
Hey, can I ask questions?
Of course.
Okay, thank you, Alison, for this really exciting presentation. I wish I knew this framework for my thesis. So I would like to ask a question. So this framework is to monitoring economic and social rights, and my question is that what if I want to make an evaluation or doing an analysis for a mental health service in Indonesia without considering the economic aspect. Can I use this framework? If I can use it, then will it change the resource dimension on this opera framework? And the second one, I would like to know if you have a full papers as the sample that use this opera framework. Thank you.
Thanks for the question. I'm delighted to hear that this isn't the first time that you've heard about the opera framework and you've used it before in your research, and would love to know more about your research. But yes, it is actually a framework that we've used to look at mental health services before. We did a project in Kenya with the National Commission on Human Rights. And there is a link in the Google Doc with the agenda. There's a link to other examples, and the Kenya example is there. And yes, we didn't really have just the composition of the research team and the kind of focus of the work that we were doing at that point. We didn't have a very in-depth focus on the R dimension of opera then either. The one thing we did look at, although there wasn't very much data available, was just how much of the health budget went to mental health. And it was quite a shocking number. I think it was like 0.1%. But we didn't have the capacity, and it wasn't really within the scope of the research to look more broadly at the reasons why the health budget was what it was within the kind of broader economic context of Kenya. So yeah, you definitely can, as I said, kind of foreground one or other of the dimensions of the four dimensions, depending on your focus.
Any other questions before we maybe move on to that prompt question? I have a question. I have a question about scale. So it seems like the opera framework is super flexible because, of course, it's based on these broad human rights norms. Of course, with our global youth consultation, the scale is not necessarily the level of a country. It's the level of kind of a global region or kind of the entire world. So kind of looking at, many kind of different clusters of countries kind of at the lowest scale. I'm wondering, have there been any applications of opera, or maybe any thoughts, ideas, or considerations that you have for using opera at that scale?
Great question. Not that we're aware of, I don't think there have been any applications of it at that scale, but when we talk more in January, we can get into some more detail about fleshing out what that might look like. But certainly regional comparison is a technique that we use a lot in order to judge the data of a particular country. So in that sense, that I could imagine that part of that feature of the framework, or that part of the framework being quite easily adapted to a piece of work that is looking more globally, or is looking at across regions for different issues. But definitely we have one other kind of conceptual piece, which maybe I'll add to the slides for next week, that kind of relates to scale, is just the different kind of activities that we do as human rights researchers that can vary from the very in-depth, very detailed, on the ground collection of like primary data through to the more kind of desk-based, high-level, what we might call auditing of just looking at broader trends over time and seeing where there are red flags and whether there are potential concerns that we would want to raise and put on the policy agenda, even if we don't have the same kind of granular evidence that we might do for a different piece of research that was supporting a court case, for example. So the kind of depth question, even within the country context, does have a lot of variety, and opera can be applied to those different approaches too.
I think that's really the beauty of the opera framework. You can kind of really adapt it to different contexts. Well, great. So then moving on to our small group reflection, kind of if there are no other questions, last call for kind of open-ended questions, everyone. Awesome. And no worries, if you think of something, please feel free to pop that in the chat or raise your hand, and we'd be happy to go back to you. So our prompt questions kind of within our group reflection discussion. Does opera give you a different perspective on an issue that you're working on at the moment? And if so, how? I have an example kind of from my own context here in Canada. But before I share, I just want to make sure that nobody else wants to share first. All right, okay. I will share. So after this presentation, this has me thinking about the right to housing in Canada. I'm an urban planner, so I'm all about housing, of course. And Alison, as I'm sure you know, Canada recently enshrined right to housing in domestic law, very exciting. Some very interesting accountability frameworks, mechanisms nationally that we're thinking about and that have been implemented, where you can submit complaints about systemic issues, and it can be addressed and resolved. We'll hopefully resolve with some recommendations. In my province, we have a political culture that's very kind of, I guess, like skeptical of like outside influence. It's kind of this interesting kind of context. And we have, of course, Canada is a very decentralized federal country. And of course, the human rights instruments, they are kind of signed by, national state governments. Of course, with, the International Covenant on Economic, Social, and Cultural Rights, it has that federalism clause that, it extends to all aspects of the state, kind of despite, any federal kind of nature. But then, we have our provincial government here in Alberta, where I live in Canada, that says, well, we're not really a party to, this human rights international agreement, so we're not gonna follow it, or like it's not really relevant to us. Kind of as a bit of a deflection technique, even though like public procurement by the provincial government follows free trade agreements, which you're also not a party to. So why, like, how do you pick and choose which international agreements you decide to follow? But nevertheless, and I think this, the presentation in Opera really kind of highlighted to me how using administrative data, because I think some of those, like the budget figures, like all of those things, like that can be used. In particular, I've submitted a few like freedom of information requests over the years, just to kind of like figure out, for example, how residential tenancy kind of legislation gets applied or not. And recently I received a data set that found that complaints by tenants that their landlords are violating applicable residential tenancy legislation, only about like 10% of them kind of resulted in any kind of enforcement action over the last decade. And I think that says something about, how security of tenure operates, which is a component of the right to housing that suggests other things as well. I think maybe, and I'm not sure how much Opera kind of relates to this, but I'm wondering freedom of information requests to kind of get the data sets from, a government. Maybe I'm wondering if maybe that's like a human rights technique that has gotten much discussion.
Yeah, lots of thoughts from what you said, Chris. I mean, I think kind of first of all, you mentioned the federal structure, and that's a good example of the kind of issue that we might look at under the A of Opera. I mentioned the kind of broader contextual factors that are affecting policy making and decision making, and yeah, in a lot of contexts, the sub-national structure and delineation of responsibilities is a big one to address. And second, the use of data, yes, and how striking numbers can be, and how powerful they can be as activists in making our case. I don't know if you've heard the expression "killer facts," but this idea that sometimes there are some facts that are just they're so memorable and sticky, and they're hard to refute, that they kind of kill off any resistance or pushback from the kind of targets that we're trying to influence in our advocacy. But yeah, so next week we're going to talk about indicators and benchmarks, which is kind of what information can be useful, and then the data is how you actually is the piece of information that helps you kind of answer that, and using freedom of information laws to get access to that is definitely, I wouldn't say it's like something we've had a huge amount of experience with, but the push for more transparency around data has been a big theme within the SDG conversations, for example, this idea that we need a data revolution in order to really be able to measure progress meaningfully. And so pushing for more open data and more like kind of user-friendly data and data that's meaningful for citizens to engage with is kind of where I would see the freedom of information piece fitting into a broader debate and a broader discussion around how to make how to address the kind of the power imbalances between decision makers and everyday citizens and people, because that protection and lack of transparency around what decisions are being made on is a big way that kind of reinforces the power imbalances in decision making. Sorry, that was kind of a long answer, but your comment sparked a lot of thoughts on my side.
Yes, and apologies for taking up so much time with those comments. I just wanted to open the floor to any concluding comments or any other questions from anyone else on the call. And if not, oh, Paul, go for it.
Okay, thank you so much, Chris. So maybe just a concluding a comment or maybe like reflection within today's call is that since International Pharmaceutical Student Federation, we weren't using Opera framework before or any like basis framework for like most of our like not really like a structured research, but like more on a like general basis. So I think I might be able to like incorporate Opera frameworks hopefully within like a research that we are planning to do like within the universal health coverage. So I think we can be able to use the Opera framework for anchoring it within the right to health, because we wanted to kindly like highlight like what measurements or like how can we measure this different kinds of like concept that we want to measure, like in terms of like within the rights of people as well as disparities and maybe like the progress of universal health coverage within the time. So yeah, I hope, yeah, I guess that's for me, and hopefully I can be able to like provide this to our organization. Thank you so much for your presentation. Thank you, Chris. Back to you.
Awesome, thank
Thanks,
you,
Paul. Just to say, we've actually had a couple of conversations with different groups about using Opera specifically on universal health coverage. So I can add a couple of things to the Google Doc, but also feel free to get in touch. My contact information is on our website if it would be helpful to have a follow-up conversation.
Thank you so much, Alison. Thank you.
Yeah, that would be a great conversation, I think, in January too. Zita, go for it.
Okay, so I just want to give a perspective, new perspective. So my previous thesis is about the health service for people with the mental health issue in Indonesia, objective-oriented model for my research. But after I know this Opera framework, I think I just thought about something that maybe can change the way I already analyzed. I have found some many things that goes wrong in my analysis, in my research, and with this Opera framework, I think I can express how I can write them down, and also make it related to the economy, because I think getting adequate health service it cannot be separated from economy issue. And then I think my next research will be the development from my research with this Opera. It definitely will be different, because there will be like the resources, the budget allocation, that it is very important when you are trying to analyze a policy implementation. How is that? How effective is that? And how how's the budget? Is it effective enough or not? Something like that. Yeah. Okay, thank you.
Thanks for that reflection. And yeah, just to say, we're doing more and more work on how to make economic policy more accessible and build kind of confidence and skills for non-economists to be able to also think about and grapple with these questions, because economists like to think that they're the only experts on the economy and that no one else has any legitimacy to question these bigger picture questions. And we really want to challenge that belief in our work and to really make a much broader range of activists and activist researchers involved in those conversations. So I'm encouraged to hear that you're more excited and more motivated to tackle the economic questions after hearing the presentation.
And well, that brings us to the end of our time together today. Thank you all so much for joining. And please join us again next week for our final webinar of this series, where we will be looking at indicators and benchmarks. And thank you again so much to Allison for your time and your expertise, and for your willingness to engage with us on these really important issues. Thank you so much.
Thanks, everyone. Just to say, when you're logging off, there's one final ask in the Google Doc, which is to just answer a couple of very short questions in a survey, which is really, really helpful feedback for us in kind of developing these materials even further. I would really promise it's less than 2 minutes worth of your time, and it's really, really useful.
Yes, everyone, please.
So thanks so much for joining.
Thanks, everybody. Take care. Bye.
Thank you, Chris. Thank you, Alisa.
Bye.
Thank you all.
Thank you all.
Bye.
Bye-bye.